Somalia's government is appealing for international help in providing clean water as well as education and health services in areas liberated from the armed group al-Shabaab. It has also urged locals to support its efforts to restore public services in the affected areas. The Somali National Army has in recent months taken full control of huge swathes of land, including towns and villages that were under the control of the militants. Mohammed Kahir reports from Mogadishu.
Somalia's National Army, supported by local mobilization forces, have taken back huge tracts of territory from armed al-Shabaab since a large-scale military operations was launched 9 months ago. The newly liberated areas, which were in the hands of the militant group for decades, lack basic facilities such as health centers and schools. President Hassan Sheikh Mahmoud has appealed for help from a local business community to fill that gap.
The stabilization and delivery of essential services is for all of us, and we will provide what we can. Therefore, we call upon the business community to help us provide clean water, build schools for our children, maternity centers for pregnant women, and vaccination clinics for our children.
The Somali government will also need international support and goodwill as it rebuilds the liberated areas. The UN's Children's Fund says it's already providing essential life-saving services to thousands of people in the newly recovered areas.
These interventions have been in 4 priority districts. These are Aden Yeba, El Bur, Hardere, and Adado. We have been able to access and be able to provide water and sanitation facilities to around 50,000 people. This is to prevent outbreak of diseases. We have also been able to provide basic health services to around 24,000 mothers and children. This is through deployment of 2 mobile health services that have been able to cover around 10 villages. We have also been able to reach around 40,000 people with various messages on child protection. And we have been screening and treating malnourished children. And we have also been able to reach around 30,000 pregnant and lactating women with malnutrition prevention messaging.
The humanitarian agencies operating in Somalia face many security challenges when providing services like health and education. UNICEF says the aid agencies also need adequate funding to support the local communities.
Funding is really very critical. As you can imagine, the basic infrastructure, health facilities, schools, water points in the newly accessible areas have been decimated. Therefore, putting them back is a very capital-intensive undertaking. Therefore, it requires significant amount of funding. On the other hand, Somalia is struggling with life-saving humanitarian emergencies. Therefore, there are a number of competing demands to tackle the resource constraints in Somalia.
During the past week, Somali Disaster Management Agency delivered relief supplies such as food. As military operations continue and more areas is recovered from armed al-Shabaab, the needs of people living in those liberated areas continue to grow. But the good news is that swathes of farmland is ready for cultivation to boost food security in Somalia. Mohammed Kahir, CGTN Mogadishu, Somalia.